Telling somebody they have cancer is probably one of the hardest parts of my job. In fact, I had 3 patients just this past week, one with breast cancer, one with liver cancer, and another with lymphoma that I diagnosed, and they all had something in common. They all had small, subtle symptoms that started to get worse over time, so they finally decided to come in and talk about it. And that was the key. They recognized something was off and they didn't ignore it. So today, I'm going to help you recognize some of the most common symptoms of cancer that you need to watch out for if you're going to catch these early. So keep watching, because this very well may save your life. So let's lay a little groundwork before we start to go over these. First of all, as we start talking about these symptoms, it's important to realize that most of these are very nonspecific, and if you have them, it doesn't mean you have cancer. It just means you need to get in and have them looked at. Second is that the reason we're going over these signs is to help you catch cancer early and give you the best chance of beating it. With a lot of cancers though, waiting to have symptoms can still be too late. So it is so important that you talk to your doctor about what kind of preventative tests you need to do. So please, please, please get your Pap, your mammogram, your colonoscopy, and any other screening test that you're due for, because that really is the best way to catch some of the most common cancers early. So here are the top things that you need to be watching for. The first sign to watch for is worsening fatigue or extreme tiredness that doesn't get better with rest. Cancer is a very energy-intensive disease. There are cells that are replicating uncontrollably, and that takes a lot of energy for your body. Sometimes it can make you anemic or change other parts of how your body's working and can make you exhausted. The next is a very common one, and is the exact reason that my patient with liver cancer came to me. She had about a 20-pound weight loss over the past few months and couldn't figure out why. So any weight loss or weight gain over 10 pounds or more over a couple-month time period when you haven't been trying could be a cause of concern. We all would love to lose a little weight, but cancer is not the way to do it. The next is watch for eating problems such as not feeling hungry, trouble swallowing, belly pain, or nausea and vomiting. There aren't a lot of great screening tests for cancers involving the upper abdomen, so watching for worsening symptoms like these could be important. The next sign could be swelling or lumps anywhere in the body. This could be your lymph nodes in your neck, your armpits, or groin. In your breasts, whether you're a guy or a girl, your testicles, or really anywhere else in your body. If something is getting bigger when it shouldn't, then get it looked at. Pain could be a symptom that you would want to watch out for. This could be headaches, pain in your chest or abdomen, back, or other bones. Any unexplained pain that just isn't going away or is getting worse needs to be looked at. One of the saddest examples we can sometimes see is in children. They can complain of pain in an arm or a leg that just doesn't go away, but it gets ignored, feeling maybe it's just growing pains, but they end up having cancer. The next is keep an eye on your skin for changes, such as a lump that bleeds or turns scaly, a new mole, or a change in a mole, a sore that doesn't heal, or yellowish color in the skin or your eyes. Watch for a cough or hoarseness that doesn't go away. Certainly, if you have a history of smoking or exposure to smoke or other cancer-forming agents, you should be even more cautious. But just because you haven't smoked doesn't mean you can't get cancer in the lungs or the throat. Another one you may not think about is unusual bleeding or bruising for no known reason. You can start having bruises, especially in places you may not normally have them. Bloody noses or bleeding gums, or your periods may start becoming longer and heavier with no other explanation. Watch for a change in bowel habits, such as constipation or diarrhea that doesn't go away, or a change in how your stools look. Watch for significant persistent changes in color, like it turning black, or a change in the shape of your stool, where it may turn really thin, like a ribbon or a pencil. Watch for changes in how you urinate, such as pain when passing urine, blood in the urine, or needing to pass urine more or less often. If you're a guy, in addition to these, you may notice a weaker urine stream, or may need to get it more frequently at night. Another nighttime symptom can be having fevers or night sweats. This is when you wake up at night with your sheets drenched. If this is happening, especially with some of these other symptoms we've discussed like weight loss, then you need to get in and have this evaluated. Watch for persistent sores in your mouth or areas that are bleeding, painful, or numb, or worsening issues with swallowing. Watch for worsening headaches, behavior changes, or other neurologic symptoms like difficulty walking or arms or legs not working quite like they should, or vision changes like double vision, or changes in hearing on one side versus the other. As you can tell, going over this list can make us all wonder if we have cancer, because we've all had at least one of these symptoms. So I don't want you going through this list and picking one thing out of it and worrying yourself to death that you have cancer. But nor do I want you to look at this list and think that just because your symptom is not mentioned that you don't need to worry about it. The signs and symptoms that I went over are just some of the most common ones that we see with cancer, but there are all sorts of ways it can present. The most important thing that you need to take home today from all that we've talked about is that you need to pay attention to changes in your body. I like to explain it like this to my patients. You need to look for the 2 P's. If something is persistent, meaning it's not going away, or progressive, meaning that it continues to get worse, don't ignore it. Get into your doctor so you can talk about it and see if it's anything you need to worry about. Catching cancer early is the absolute most important thing you can do to increase your chances of treating it successfully. So pay attention to these or any other symptom that just isn't going away and get into your doctor to talk about it. If you're looking for the best ways to catch cancer early before you even have any symptoms, then check out my playlist here where you can see what kind of screening you should be doing today. For everybody else, we just want to thank you for spending a few minutes with us today. We really hope that you've learned something that will help you or a family member. That's our aim here at Family Med, to provide quality and reliable information to help you make better decisions about your health. So until next time, be healthy and stay healthy, and we'll see you in the next video.